professor here at the University of Costa Rica, and I got my PhD at Auburn University. Um, and that was a few years ago. And now I'm here in Costa Rica, mostly involved with research and teaching research classes, and also collaborating with some research groups that we evaluate the some of the projects that for grants and outreach. And so we have I've been in this like for 4 years now. I'm a little bit tired doing this every week, but it is super fine. I love doing research. I think research is I'm not gonna say the only way, but it will be the best way to create a better understanding of the things around us. So how to understand what is going on with our body, with our mind, our all our psychological, physiological system, and so I hope you guys also like doing research and advance in knowledge. I don't know what else to say. More than saying thank you for inviting me. Uh, a short request for everybody: just say aloud your name, and maybe if you can turn on the camera, that will be great. I don't know how many are here. Well, I'm not the administrator, so I cannot see. Oh, 19. So we got 17 students. Um, so if you guys can say aloud your name, I do appreciate it.
Hi, I'm Jessica. I'm a senior.
Great.
I'm Alex, and I'm a senior as well.
Who
Hey,
else?
I'm Alex, and I'm also a senior.
I'm Andres,
Come on,
and I'm a
guys.
senior as well.
I'm Megan. I'm a senior.
All right.
I'm Jimmy. I'm a senior.
I'm Sammy, and I'm a junior.
I'm
I'm
Andrew.
Annika. I'm a senior.
Hi, I'm Alessandra. I'm a senior.
Still missing a few. Come on, guys. Don't be shy.
I'm Noah, and I'm a senior.
I'm Kaylee. I'm a sophomore.
I'm Juliana. I'm a senior.
I'm Gianna. I'm a sophomore.
I'm Nathan, and I'm a senior.
Okay.
I'm Sean, and I'm a senior.
I don't know if we are missing someone still. Okay. So from this point, please feel free to interrupt, to ask questions, to participate. You don't have to raise your hand. Just talk, and don't worry about. First of all, I would like to. What you seeing? Are you seeing the presentation?
Yes, we see it,
Okay.
Dr. Rodríguez.
I found the cowboy, the horse. I think that's. I wasn't sure about the mascot, so I couldn't. But I think the colors are those purple and white,
Yes,
which
you're
are
right.
are not are not my colors here in Costa Rica. these colors are for a team that I hate here in Costa Rica, but okay, let's start with this. I have another meeting at 9 today. It's super crazy, so I'm gonna try to I'm gonna make my best. Let me say first, which I told Javier that I've been in I'm in 4 communities here, and I have meetings all week long. So that's um, let me see what is the meeting about. Uh, oh yeah, okay. Let's start with this. So Mr. Lopez told me that you guys are in the like basics with body composition. Is that right?
Yes.
Okay. So let's introduce to body composition. Let's talk about some measurements, some assessments, and why we do body composition. And I'm gonna focus more on health, but also we can add that to the performance, which is not different. So, oh, let me do some presentation. Okay. So first of all, can someone tell me what do you think it is body composition? How to describe it? Someone. This is an open question. Don't be shy. Just what do you think it is body composition?
Is it
Jessica, sorry.
measuring
Okay,
fat
Sammy,
mass and fat-free mass in the
I'm sorry,
body?
say again.
Measuring fat mass and fat-free mass in the body, like
Uh-huh.
whatever makes up the body
Okay.
weight.
And why we do that? Why it is important?
We assess the overall health of people.
Health of people. Uh-huh. And what about performance? Is it important for performance?
Yes.
Why, Alex?
Because depending on sport, I know like we've looked at tables before, each sport is dependent, will have different body fat percentages, and so you can base it off that.
Yep. Yep. So so what we want to know with body composition is the different types of tissues we have in our body. And when we measure it, we want to know the composition of each tissue, like how much fat we have and where is it located. Like uh, for some, let's say for health, we would like to see how much fat we have in our trunk, in our belly, our chest, which is all related to our systems, organs, important organs like our heart, liver, kidneys. So we always want to know if we are measuring body composition, like focusing on fat for health. But also, what about lean mass? We also want to know more about lean mass. If we are working with health or we are actually working with performance, what to do, how to do it. What about if we have a baseball player or we have a runner or we have a football player? Body composition is going to be completely different between a football player or a runner, for example. It has to be, it must be, because a runner doesn't need that much fat. Football player also doesn't need it, but it might be. If you see the big guys playing football, um, they are big, so they keep some more fat. But where is it located? It is super important, and that's something that we're gonna talk today about that. So knowing our body composition is more important than just knowing how much we weigh. What is our weight? And for health, it doesn't work like, oh, yeah, you are 200 pounds. And just looking at you, you are fat. No, might not. We have to make sure that we are measuring the exactly amount of fat and lean mass and all those tissues to understand how the composition will affect you depending on if you are healthy enough or you are in a performance field. So we need to know exactly what we are doing. So how our body is made of. So I think Sammy said about what is body composition and the components. So fat mass, all the fat in our body, that it's good fat and bad fat, subcutaneous, like under the skin, and also visceral fat around the organs, which is the most important if we are measuring for health and for performance too. So that fat around heart, liver, kidney, etc., will kill us. Will develop diabetes, cardiovascular disease, metabolic syndrome. So we have to be aware, completely aware of body composition. Where is the fat? But also we want to know the fat-free mass, like the lean mass or muscle. So if we are working with performance or another guy that is losing weight or losing muscle, we have to build up the muscles again to make sure the lean mass is good enough to stay healthy. But also we want to know bone density, how the organs are inside our body, and about water too. Anytime you guys have a question or comment, you can do it. So this is about the human body composition, man and female, muscle, essential fat, because we need essential fat. We cannot be 0% fat because we die. We need fat in our bodies. And see, the essential fat for men is 3%, for women 12%, and non-essential fat 12 and 15, which is the fat that we accumulate just because that's the system. And then we have a bone density, and then other tissues 25%. So this is our body. This is how our body works. So why we measure in body composition now? Well, first of all, we started looking at the body shape difference and health at the beginning, and we have to remember that many years ago, being fat was a sign of wellness. Being wealthy was tied to fatness because those with a lot of fat had money to buy food and to live a good life, right? So then the BMI came up and the weight chart for population health, and you probably have seen the charts where depending on the BMI, you guys know what is the BMI?
Body
Yeah.
mass index.
Yeah, and how to measure it, which is weight and height. So, but do you think is it a good measurement? BMI?
I don't think
Yeah.
so.
I No. feel like it's a little outdated, maybe.
Oh, hold on, say again. Let me see if I can put my volume up because okay, I have it. All right, go ahead.
I said not really, just because I feel like a healthy individual can still like even if your BMI is a little up, technically according to the index, it could say that you're overweight, but your actual weight could be like within your body frame.
That's super important. And guys, why you think that? Why giving someone a qualification because we got a BMI of 30 and you say you are fat because you have a BMI of 30. Do you think that's right? Good enough to prescribe exercise or to talk with this client or with this person about health issues? Remember this chart before. This can change. The body composition can change if we lift weights. Then we have muscle increase. And maybe the essential fat is good, the non-essential fat is good, but what about like football players? That's a good example. Football players are big, a lot of muscles, but it is not right if you say, oh, see, this football player is super fat. Unless you see a big belly, it might be different. So BMI is not the right assessment to indicate if you are fat or not, or you are healthy or not. So there are other aspects we have to take care of. So then the 20th century hydrostatic or skin folds, we are going to talk about them. Then DEXA, BODPOD, bioimpedance, and body metrics or ultrasound. So all of these methods were built to calculate or to analyze body composition, looking for a more precise measurement. So again, why it matters? Why it matters to measure body composition? We want to know about health, cardiometabolic risk, chronic disease, healthy aging, I'm sorry. Or if we are looking for performance, for example, muscle mass, which is going to influence the strength, the power, the endurance. So that's why we do body composition for performance or for health. So we want to know exactly what's going on. So let's advance. So we have two component fat mass, fat-free mass, or four components, adding mineral and water, depending on the scan, depending on the measurement. So some common assessments that we can find around is the BMI or waist circumference. It's quick and cheap, but it's not accurate. The skin folds, bioimpedance or hydration sensitive DEXA or hydrostatic MRI, etc. There are many. So let's start with hydrostatic body composition assessment. I think I saw a picture that Javier was showing you guys. So it follows the Archimedes principle and measures how much fat, how much water, and how your body, your density is going. So how it works. So it is just a step in the scale outside, get your weight, and then into the water. And then with some calculations, we can get the density and the fat percentage. So this technique almost, I mean, it is not the common right now because it's a little bit more difficult to measure, to calculate. So you have think about you having a 70 years old lady that has some issues, health issues, and they have to put her into the water, etc. So it might not be the best idea to measure body composition by putting her into the water. So what about if we do DEXA? Do you guys know what DEXA is? Have you got some of you got some DEXAs before or DEXA scan? Any idea? Okay, let me see if the picture, I think I got a picture over here, and then I'm gonna this picture over here. This table, that's the DEXA scan. So what it does, it goes from with you lay down basically, and then the scan goes through you, X-rays, and it measures everything you have in your body: bone, lean mass, fat mass, essential fat, and also let me see what else I'm missing. Mostly that. So why is it important? If you want to know about bone mineral density, to see if you have osteoporosis, then you have to have a DEXA scan. This might be the most accuracy assessment, which is going to measure the entire body by sections, by hands, by fingers, by shoulders, chest, stomach, legs, etc. And you can divide them. As you see here in this chapter, everything you can see here can be measured. But also, it will give you the bone mineral density for women that later on might develop osteoporosis. Then you will see here, for example, I'm going to show you another picture right now, but below this yellow, this light blue line, all the way down, is that shows that you are losing calcium or bone mineral density. So you are in a higher risk for developing developing osteoporosis. If you are in the light blue line, you are good, and according with the age too. And if you are in the green line, you are good enough. So this is for bone mineral density. And then, well, this picture is a little bit too small, I'll say. I don't know if you guys can see it. But this is the picture about, this is how you see it inside your body. So see the colors down at the bottom, and then you see the arms and by regions, the total mass, depending on like if you are measuring arms. For this guy, arms, fat is 26.3%, total mass 28.9 pounds, fat tissue 7.3 pounds, lean tissue 20.3 pounds, and bone mineral density 1.3. So if we go every section here, then you can see exactly where like if you develop in this osteoporosis, most of the time you see osteoporosis at your spine, and it is pretty dangerous when you see it at your spine. You might have a good readings here, but your spine might be too low, or ribs actually, pelvis. So these three components over here, or the total trunk, are super important if you are prescribing exercise. Like, for example, if you are doing an intervention with old people, you want to you want to know first before like giving lifting weights prescription, because you don't know if the person has osteoporosis and you are putting her on a bench press or squats or something, and then you are not given the best exercise to this client or to this person. So the DEXA scan will give you the entire sections and everything. And here is the chapter for a woman and a man about, depending on the age and where you have to be. So on this one, what you want to see is, instead of using BMI, how much fat you have in your body. And from there, now you can see if you are above or below the normal standard. This is another picture for bone mineral density, and see so normal bone density, and then you get into the yellow line here, and then osteoporosis for the red line, and it is not good enough. It's a bad sign that you're developing a bad disease that can be overturned, but it takes time. Okay, pros of using DEXA is a high accuracy and precision. These are the best assessments, the best result you can get, and you get all of them at once. Then, as I said before, the tailored regional analysis. This is the gold standard method right now. I would say fast procedure, yes. 5 to 15 minutes. I will add a little bit more. I was doing some DEXA scans in Auburn with the football players, and those guys with 300 pounds, it takes around 20 minutes. And for clinical and research settings, this could be the best assessment you can get. Then the problems here, or the cons, disadvantages, radiation exposure is low, but it's still radiation. It's a high cost. This machine over here might be something around $200,000, maybe more, plus maintenance. So not too many people has this machine. Also requires trained personnel and positioning sensitivity. So if you go beyond a line over here for your head, it won't start. If you don't put your feet straight, like the tips up, it won't go through. Also, another problem is if you move, like it's going through your belly and you move your body, it will stop immediately. So you have to be still during 15 or 10 or during the time of the scan, and that's super hard to be in 15 minutes like that. So this is another bioelectrical impedance analysis, which is a machine. You might have seen this probably, which is a scale, and you get the electrodes here, like this girl is showing over here, and then you get the measurements. It's not invasive, but it's not the best idea to measure with this. But if you don't have anything else and you have this, use it. So what it does is the electrical current goes through your body, like the yellow spot over here. That's what's going on, and it is measuring everything inside your body. And some process, like it is not invasive and it is safe. It is quick and convenient. You can move it everywhere. You can now move the DEXA. You have to have a special room to do the DEXA scan because it has radiation. Then estimates multiple components. It's good for tracking over time and requires minimal training, and might be able to buy it. Depends on, might cost something between $5,000 to $10,000. Not the 200 or 400 that thousand that will cost the DEXA. The cons is if you are dehydrated, then the DEXA won't read. I mean, the scan won't read good. So you have to be hydrated in order to get a good reading. It's less accuracy in certain populations. And I've seen that before, like it is really hard to get the right numbers. And when you compare it to DEXA or other assessments, it is a little bit different. And it's subject, I mean, it doesn't measure direct, doesn't give you direct results. The results are estimated, so it's not like DEXA. And if you had a drink or food before coming, it will affect. The device will vary depending on, and the details are not as good as DEXA, for example. I'm going a little bit through everything. I got 20 minutes, but I'm gonna try to do this as quick as possible. The skin folds. Have you seen this? The skin folds first? Before? This I don't like the skin folds. I really don't like them because it is invasive and also just something. Sometimes you feel the pitch there, like something that is not good, and you have to touch the person, and depending on it won't be good. But it is not expensive and requires training. So there are some spots for men and female, different spots to measure. Cost effective. You can use it for research, but it might not be the best idea. It might not be the best to get the right results. It is easy to use. It is affordable. You can take it with you everywhere. It is kind of fast to do this, non-invasive, which I'm not agree with this. You have to touch people, and sometimes people don't like to be touched. You can track changes over time. Yeah, one of the important things is that is worldwide use. So there are standardized protocols and numbers that you get once you do this. So cons is accuracy depends on the person applying it. Variability between measurements, less accuracy to qualify lean or fat in fat people. It's harder to use. And assumes typical fat distribution, which is not right. It cannot be used for everybody. And we do not, I mean, the estimates are not direct measurement. So that's something important that we have to take care. This is another assessment, the BodyMetrix system. I personally use this one. I have this one, which is it's not too expensive, and it's ultrasound. It uses ultrasound to measure your body composition. And it is once you start using it, it is super easy to apply. So it is a non-invasive. It's accurate and reliable. It's portable. You can take it with you everywhere. It gives you detailed body composition analysis. You have the results immediately. and it doesn't matter about hydration. It measure because it is ultrasound. So this is the machine that physicians use to check your belly or for pregnant to see the baby inside. This is about the same. Or to see for tissues, specific like muscles or damaged muscles. So this picture over here is a picture of a muscle, as you can see here, and you can see the layers, the different layers of the muscle here. So you see the red lines and the white lines. The white lines or the white spots are this is all this is fat, and the red line is the layers of the muscles, and the blue the lean mass of the muscle. And I like it. I really like it. And people like it too because it takes about 2 minutes to do it. And takes the same skin folds spots to do it, but you don't have to touch people that much. Ooh, I think I didn't. Oh, the pros. And the cons is that it's kind of high initial cost. Let me tell you, it will be something like $3,000. And is more expensive than the skin fold, yes. Requires training, yes. The main thing with the is the placing the ultrasound in the right spot. And also, this is a new system, so validation is a problem right now because it doesn't have a lot of data collected already. And sometimes in those two error. And this is the results. I mean, this is what you get. So the yellow up here to the peak, this is the fat. And the second wave, the second peak here is your muscle. So what you see in here, the 22.4 body fat, this is what you get. But then you have the graph down, which shows you the estimated water, the fat-free mass, the red triangle, then the yellow, the essential fat, and then the excess or non-essential fat that you have, the small one. So this guy has the 5.4 pounds of non-essential fat, and that's where you have to work. That's why you have to look at it and start trying to build up a little bit more muscle and reduce a little bit of fat. However, if you see the body fat is at the borderline, getting above the borderline, so if you reduce this fat and increase on lean mass, then your body fat is gonna be just right. So waist circumference, why we measure it? Well, we measure it because depends on the belly measurement, then you have more or less risk to develop diabetes, metabolic syndrome, cardiovascular disease, etc. So it is important to measure belly or waist circumference. With this number, then we will have a better idea where is the fat located. If we have more fat in our belly, then it is not good. So these are the numbers: 94 or 30, 37 inches for men, 32 for women. And then when we measure it, we have to make sure it is below the belly, the umbilicus a little bit. And that number is related to diseases. And when you have the ultrasound, there is a specific assessment here, you can put the waist circumference, blood pressure, and other assessments here, and then we will do the risk assessment for you. So you will get that risk assessment from the body metrics. I like it because it provides you everything, and at the end, also a report, the entire report for the client with all the specifics. So this is a short comparison between all devices we talk here. So like, which is non-invasive, the tail muscle analysis, hydration sensitivity, cost, high, low, very high, easy to use, validation. So see all this comparison. So from there, if you have the money, then you can start with the budget and see if which one you can get. So it is important to understand accuracy versus accessibility. See, if you want a higher accuracy, then the cost is going to be higher. But you have to choose the method depending on the on purpose. What is your main? What is the purpose of your study or what you're doing, or if you are doing for health or for performance? So, what do you think about this picture? Let's talk about this. Is the can't remember his name, but is the heaviest football player in history. 410 pounds. On the right, this other guy, the old guy, is also 410 pounds. So the same weight, if you see both, but just by looking at them, you can say, yes, both are fat. Both have a high or higher risk of developing a disease, for example. That's why it is super important for us to know the body composition. This guy here, the football player, might not have that much of fat, probably a lot of muscle to be a good football player. And the other guy, looking at his belly and distribution, might be fat and might be in a super high risk of developing disease. So it is more important to work with evidence, not assumptions. So for the guys before, same BMI, but different health risk. So we do not predict by visual. We need to measure body composition. And the method we're going to use depends on what we have, what we can do, and our goal, and if it is for health or for performance. This chapter here, and this is a question, open question. Is BMI a good predictor for health or fitness? So we talk about this, and I think it is not a good predictor. It's just a measure that gives nothing. Okay, some examples for application: population, for health, BMI, waist circumference, like doing an assessment like by impedance or body metrics or whatever. Athletes, more DEXA related, skin folds, performance. However, I say again, if you are measuring this guy for skin folds, it's gonna be challenging. So we better look for a different method. Just to wrap up, Body composition provides you with more info than just doing weight or BMI. Focus on health or performance. Choose the assessment based on the purpose and the goal, the resources you have, and what you're gonna do, what you want to do. So, which method is most useful for assessing health risk in a population? So it's gonna be depending on what kind of population, the resources we have, the goals, the objectives we have for the measurements, and what we're gonna do. Those are some pictures from Costa Rica. Thank you for the opportunity. Open to questions, comments. Sorry to be a little bit just informative. I hope this short info that I share with you guys is useful, or you can use it, or you can advance your career. My hope is to collaborate. So I'm open to questions, comments. I got 10 minutes still.
Guys, common questions. Thank you, Dr. Rodriguez. Was great your presentation. Some of these students, this is their final of their career. Some of them are looking for study a postgraduate course. Many of them, they are athlete students. Maybe if you have questions regarding your own experience as an athlete, or some questions, because Dr. Rodriguez is going to have a minute and just a meeting in just 8 minutes. So it's open. Get advantage of his presence.
I was just gonna ask, how do you like living in Costa Rica?
A lot. Good question. Yes, a lot. However, I studied in Auburn. I spent 4 years there. I think the university is great. The town is great, and I'm missing it a lot. But also, Costa Rica is amazing. I just live into the forest, into the woods, by the river, birds, all kind of animals, and that's the noise that I get here. We having a lot of rain right now, and the Melissa hurricane is coming. I don't know if it is coming this way or your way, but it's affecting us too. So with that, a lot of rain, but going to the beach, 1 hour driving and choosing from 10 or 20 beaches, or going to the volcano or to the hot spring waters. That's great. That's something that I missed in Auburn when I was there. Being close to everywhere, because if you want to go to the beach in Auburn, you have to drive 5 hours to go to Orange or other like Pensacola, uh, or Panama Beach. But if you want to go to the mountains, then you will looking for Tennessee, Smoky Mountains, so another 5 hours. And yeah, but yeah, I love it living here. You guys can come over here.
They have an excellent postgraduate program in exercise science. It's like amazing, amazing over there, guys. So before I'm going to before leaving, I'm going to share to you a little bit of, well, a big thank you, Dr. Rodriguez. Jessica, you always help us with this. Can you please read this one for Dr. Rodriguez before he leaving? I'm going to share to you guys.
Yes.
What was that?
Uh, um, okay. Do you see it over here?
Yes. Certificate of Appreciation. The Department of Exercise and Sports Sciences at New Mexico Highlands University hereby presents this Certificate of Appreciation to Dr. Mynor Rodríguez Hernández in recognition of his valuable contribution as a guest speaker for the presentation entitled Methods of Body Composition Assessment, BodyMetrix, Ultrasound System, and DXA, presented to the students of the Department of Exercise and Sports Sciences on October 28th, 2025, enhancing their academic experience and professional development. We sincerely appreciate your time, dedication, and commitment to the education of our students. Las Vegas, New Mexico, October 28th, 2025.
Thank you. Clap for
Thank
him.
you.
Thank you, Dr. Rodríguez,
Thank you
for
so
this
much. I do appreciate it.
for this
I do appreciate it,
opportunity.
guys. Thank you.
Before
And
leaving, please. Oh, sorry.
it was my pleasure to meet everybody in here, at least by Zoom, and hope someday I can travel around and visit you guys over there. You might not be there, but yeah. Just keep up with the good job you're doing. Keep up with the grades, and most of you are about to finish this year, and I hope you jump to the next step, to the next chapter of your life, going for a master's and PhD and improving your career. That will provide you with a lot of tools to live the life you want, but mostly preparing your brain for all the challenges we have right now in our lives.
Thank you, Dr. Rodríguez. Please turn on your camera to say goodbye to him. You need to see something that in Costa Rica says that is pura vida. It's a way to say hello and means many things. Thank you, Mr. Rodríguez, for everything, for this
Thank you.
opportunity.
Thank you,
And,
Mr. Rodriguez.
and we will
Absolutely.
see
Thank you, guys.
soon. Thank you. Don't go, guys. I'm going to
All right.
make an agreement with you
Bye.
because we had the hydrostatic waiting lab, and I had the listing here, but I was thinking, I don't know. It's just alphabetic for this one. Mr. Alex Galvan is going to help us with this. And the place is very small to be everybody here. So I divide the group, and you're going to be in here from Kaylee to Aragon Juliana. You should be in here in 2 more days. From Andres to White Therese, November 6th. Okay. Other thing that I want to ask you, do you have during these 2 weeks like athletic commitment? Like, for example, playing in other states or don't be at school at that time, you can maybe switch, especially the sports that are in season. I think is volleyball, but we don't have volleyball players in class. We have many football players. I don't know if this affecting you to have the experience of doing this lab. No, everything good? Perfect, guys. So we will see you in 2 more days. Kaylee, Ethan, Galvan, Moises, Samuel, Alessandra, Dawson, Keone, Cheyenne, Andrew, Alex, Noah, and Juliana. And you don't need to be in here November 6th because it's going to be the other part of the group, okay? Thanks for the opportunity. Thanks for your time. And please, about your notes that you're doing, that you did regarding Dr. Rodriguez Hernandez presentation, please, out loud. It's going to be closed at 10 o'clock, okay?
Can you open the assignment, please?
Oh, yes, I will do it. Thank you, Jessica. So, guys, thank you very much. See you in 2 more days. Thank you, Mr. Galvan.